Great news for the Central Valley. More than 100 UCSF Fresno medical residents and fellows have graduated. More than 40% of them will stay in the Central Valley to care for patients, teach future physicians, or continue their medical education. Dr. Michael Peterson, the Associate Dean at UCSF Fresno, calls the decision to stay outstanding, given the current and projected shortage of primary care clinicians in the region and state. According to a report released earlier this year by the California Future Health Workforce Commission, California is facing a shortfall of more than 4,000 primary care clinicians. The projected shortfall in the state will have a disproportionate impact on the San Joaquin Valley, where a doctor shortage unfortunately already exists. Physicians who understand the cultures of Valley patients are especially needed. And when it comes to rabies cases in people, bats are the #1 cause, according to the Centers for Disease Control and Prevention. 7 out of 10 Americans who die from rabies have been infected by bats. Researchers looked at infections from 1938 to 2018 and found 2 distinct patterns. Until 1960, most infections came from dog bites. Then, following a push for mandatory pet vaccines, that shifted. From 1960 to 2018, 70% of human rabies cases came from bat bites and scratches. When an infective animal bites a human, the rabies virus is transmitted from saliva through the open wound and into the nerves. Then it goes to the brain and spinal cord, a process that can take between 3 and 12 weeks. Symptoms in humans include hallucinations, insomnia, drooling, and fear of water.